changes or abnormalities in your dog or cat's urination habits, he or she may be suffering from one of many urinary tract diseases. To treat them successfully, since many of these problems present similarly, an accurate diagnosis is essential. Some of the more common symptoms you might notice are straining to urinate, urinating more often, bloody or red-tinged urine, or even urinating uncontrollably. Many dogs and cats will seem to forget their house training habits and start urinating around the house in abnormal locations. Some of the more common bladder diseases are urinary tract infections, feline lower urinary tract disease in cats, bladder wall diseases, which can range from inflammatory conditions to cancer, bladder crystals and stones, incontinence from a weak bladder sphincter muscle, and kidney-related disease. Urinary tract infections seem to affect females more than males, probably because of the shorter distance from the outside world to the bladder in females. Males, however, seem to suffer from crystal and stone problems more often than females, most likely due to their narrower urethra. Both sexes are equally likely to form the stones and crystals in their urine, but the females often pass them uneventfully. Stone formation is a result of a combination of factors: how a pet metabolizes its diet, the pH of their urine, their water intake, activity level, and genetics, as in Dalmatians, who are prone to uric acid stones. In general, stones start out as crystals, and when enough crystals are present, they can form into stones. Both the gritty crystals and the actual stones can rub like sandpaper and irritate the lining of the bladder and urethra. This inflammation can present itself as straining to urinate, blood in the urine, urinating in inappropriate places, or even the inability to pass urine, which is a medical emergency. Stones may take months to form, but they can form in as little as 2 weeks. In dogs, kidney or bladder infections can also contribute to crystal and stone formation. In cats, bacteria also play a role in bladder and kidney disease, but mostly in older cats. Also, older cats seem to develop calcium oxalate stones, while younger cats usually form triple phosphate or struvite stones. So management of a pet's bladder problems may vary with age. To get an accurate diagnosis, blood and urine samples need to be submitted to a lab for analysis. Kidney problems, infections, and certain crystals can be identified this way. Radiographs and/or an ultrasound exam may also be needed to evaluate the bladder and bladder wall. Most stones will be visible on x-rays, and those that aren't should be noticeable on an ultrasound exam. In some cases, radiographic contrast studies may be needed to evaluate further bladder or kidney problems. Treatment options vary with the type of bladder problem identified. Antibiotics are indicated for bladder infections. Dietary modification with some possible supplements may be indicated for urinary crystal formation, and surgery may be needed to remove stones. When stones are removed, we always recommend they be cultured and analyzed to see which type they are. There are diets available to help dissolve struvite stones. Now, this process may take a while, and as the stones begin to shrink in size, there's a slight risk they will start to pass and potentially create a plug, which can be very dangerous. Most times, however, surgery can be avoided for struvite stones. After surgery, if needed, special diets greatly reduce the chances for more stones developing later on. If your pet is having urinary accidents, see your veterinarian immediately. Bladder infections and stones can cause a great deal of discomfort, and it's very important to make a diagnosis early and to start treatment immediately to prevent